Okay. Good afternoon, ladies and gentlemen. I'm called Dr. Juliet Adonchol. I'm a pediatrician from Ministry of Health based at Lira Regional. I'm also the focal person for child health in the whole of Lango sub-region. The statistics has already been mentioned nationally. It is common knowledge that the burden of sickle cell in Uganda lies in Lango sub-region. And of this, those who turned positive to be 1.2%. This means that 1 out of every 100 babies that we screen have the disease. And 6 out of 100 that we screen happen to be the carrier. And why are we doing this? Because it was noticed that most of the death or the poor outcome was because of late diagnosis. Children who are diagnosed late have poor outcomes. So the screening started, and immediately they are screened, they are supposed to be enrolled into care. Unfortunately, as we do this screening, sometimes these parents do not turn back to come and pick their results. We also do follow them up and call them to come, but they may fail. This is majorly because of stigma of sickle cell disease, and also because of people still fear. They have a myth that once I get the result and the baby turns positive, it's like a death sentence. Also the stigma, because women with sickle cell disease, children with sickle cell disease are greatly stigmatized. Sometimes it has led to loss of families, like they are divorced, they leave them, and even marriages have separated. They blaming one side over the other. Yes, I would like to appreciate in a special way Catherine Field for the initiative, this community mobilization, because as we know, early diagnosis is key, and also prevention is key. How do we prevent sickle cell? We say that sickle cell is, as a result, it is a blood disorder whereby the type of blood type the person has is SS. So that person is a sickler. And then we have what we call the carrier state, which is AS. That one we call it carrier or having a trait. The one I said 6 out of 100 that we tested are having carriers. So it is this carrier state that when a carrier meets a carrier, you give birth to a child which has what? Sickle cell disease. So for us to reduce the burden of disease, what we have to do is know your status of sickle cell. If you identify and you know yourself as a carrier in future will look for a partner who is AA, who does not have. This will promote mixing of the trait, and the disease burden can be brought down. So that we only have to deal with few sicklers. Okay, so this initiative is actually very paramount, and it is one of the long-term goals of, if we want to eliminate sickle cell from the population, we have to do disease screening, early screening and community diagnosis. So but still, for those that are already affected, we are encouraging early medication, routine medications. The medications we give prophylaxis. We put them on folic acid. We give penicillin. We also do malaria prophylaxis, because most of the children with sickle cell disease actually die as a result of malaria. So we do monthly prophylaxis. And we also give what? Hydroxyurea, which actually can prevent you from even getting a bone marrow. The drug hydroxyurea is a disease-modifying agent in that it changes the blood type. The S I'm talking about is going to be converted to a type which is called F. When children are born, they have a type which is F, the fetal hemoglobin. So this fetal hemoglobin does not sickle. So we change the sickle cell to fetal hemoglobin, which is an adjunct to a bone marrow transplant. It modifies the type of blood cells. So that is why we are advocating for every sickler. Once we start them on hydroxyurea early, it prevents them from getting the advanced crisis like stroke, they getting malnourished, being hospitalized. It prevents so many things, and the only challenge is that it has to be taken also throughout life. So as a regional referral hospital, we take care of these children with sickle cell. But we have challenges. As I mentioned earlier, we have about 1,200. This is only the satellite site at Lira, or the referrals that we receive. But all the other 9 sites are also issuing drugs. Once they get complicated, then they're referred. This clinic runs every Friday in the outpatients department of sickle cell disease. And as somebody mentioned, if you look at the picture of the patients there, it is not nice. But this can be changed. They can walk comfortably like any other person without being noticed that this is sickle cell. Those warriors, we call them warriors, and the people who take care of the sicklers, like the Catherine Field, the ones who support the medical workers who ensure that the warriors are taken care of, these ones are called champions. So Director Catherine Field, you are a champion in this, okay? Yeah, so we would want to encourage such initiatives so that we change the narrative of these patients with sickle cell. Currently, we are getting so many admissions of crisis, and yet if you look at the regional referral hospital, there is no space for admission. So the message from Lira Regional Referral, his main, at the moment we are admitting as long as 6 years old. So you imagine a child of 6 years next to a person, an adult who is very sick. It is very traumatizing for these patients. So we would want to ensure that we have enough space, and they have identified even space. There is a building which is deep. They have and they want to convert it. That plan, the building is currently is housing the feeding center, TFC. So they want to renovate that building, and have done analysis, and the budget would cost the hospital about work in progress. They are looking for ways to ensure that. Then they also want to ensure that this drug, which is being supplied, as we have like 1,200 coming routinely, and just one patient we give drug for a month. A box is 900, is about 900 capsules. Every person takes 30, one each day, if you're taking only one. So which means even if they give us like 1,200 boxes, you can issue that drug within a week and it is done. So there is still need for more drugs at the hospital. All in all, I would like to appreciate the Uhuru Sickle Cell Run, and I would like to call upon all the other partners for this great initiative, and coming on board for supporting. This is a noble cause, because the burden of sickle cell disease, it is actually among the major cause of mortality in the region. Among the top 5 killers, sickle cell is among them. I would also like to appreciate Ministry of Health. They have ensured that we have continuity of these drugs, and they have supplied us, only that the need is surpassing what is being supplied. I'd like to appreciate the holders of this press conference for giving us a platform to air out our views, and for communicating to the community what is actually happening as far as sickle cell is concerned. Last but not least, my message to the community. The children with sickle cell disease have capacity to grow up to their full potential. They don't have to be admitted. They can study without getting to hospital, just like elsewhere. So let us not stigmatize these children. Let us accept them and give them the due care. This would change. And then also I would like to encourage them to test early. As I mentioned earlier, once we test, we can actually eliminate and bring down the trait to a normal and decrease this multiplication. Because if a carrier is meeting a normal person without the trait, the disease is going to mix and the trait would come down. Ka gonye leblang atia kwayo ni jowot pim remogi meneno ni ka etikede ginuluoni trait kudi ametikede sickle cell. I pay nwonga wuota metikere nyo kuda pay nwonga wuota metikere ginul woningo kariani po bedo ngata tuo obedo ngata ti bala ngata ti wuota ber ame sickle cell pay kome enti chogo mere nuo tikere gin tikere korri me sickle cell omiyo jo apol kai penyo ni sickle cell ti pashu sickle cell le blau jo mar luongo ni tuo chogo pien remo en yani oyobi chogo yai chogo kai penyo ni tuo chogo ti family wu jokoni pe ento nuongo korri mere nuo tie ka korri ni orwate kere korru kene ena ye omiyo tuo tie so jo miro neno pimo remo gi apuodo jo mare apuodo jo nywalo tino meneno ni tuo sickle cell nyo tuo chogo odok piny apuoyo tutwa. Okay, thank you very much. So as I mentioned earlier, I said that at the hospital we are doing routine testing for sickle cell. So for you to know that somebody has sickle cell, we do what we call HB electrophoresis. There's what we call screening and there's what we call confirmatory. So at the hospital, we are doing what we call the screening test, which you go and you're screened and then you get the results immediately. However, that results only tell you positive or negative. Positive would mean either you're a carrier or you are a sickler. So for you to know that you are now a sickler, we have to send it to Central Public Health Laboratory, and then it tells us the percentage of the S and the A, and then you said you're a confirmed sickler. So the ones we are doing in this region, it's not confirmatory, it is a screening test. So all the patients that come, before we enroll them in the clinic, we have first to confirm. So when this machine is brought, it would be easy for us. We would do screening and we shall immediately confirm, and this would actually help. Thank you.
Do you have any confirmatory machines within Lango sub-region?
Within Lango sub-region, most of the tests we have are screening. They gives us AS, but is not giving us the confirmatory. So what we are having is at the regional referral, and yes, a regional referral, there's most of the samples. And then we have the RDT kits. Those kits tell you positive and negative. When
remind me of how long it takes for the person waiting from Lira.
Yeah, so for a person waiting from Lira, what we are using the hub rider. Hub rider means they keep picking samples from all over. So it's like post office. You go and pick, then it comes back. Ideally, the test should be back within a week. It's not automatic that you come and I give you the result. I'll give you an appointment for next week. But to be on the safe side, we give it 2 to 4 weeks. Okay? So we are giving an allowance between 2 to 4 weeks to achieve the results.
Well, a lepton with the highest burden, why?
Yes, a lepton with the highest burden because we said, as looking at how sickle cell disease is, it follows the malaria belt, okay? And the highest burden of malaria in Lango sub-region comes from where? It used to be a patch and now it is what? A lepton. So sickle cell and malaria seems to be like married couples. It is because of the science behind it.
My name is Boni Ferdinand Okelalele. I am the chairperson organizing committee of Uhuru Sickle Cell Run 2024. I'm also the Assistant Resident City Commissioner of Lira City. I want to take this opportunity to welcome you and for you to accept to come in this very important press briefing. CAPSI, being an organization that is working hard in ensuring that we have a reduction cases in sickle cell, came into play this year and approached some of us to ensure that we have a sickle cell run. The sickle cell run is scheduled for 5th of October 2024, that is next Saturday. And as I talk now, preparation is in the high gear. We have done all that it takes to have this day a success. I've already introduced to you some of the key partners who are working so closely with us, who have supported us, who have promoted this event. And I don't want to forget the media, because we reached to you before. We have been in almost all the radio stations, social media spaces, telling you about the Sickle Cell Run 2024. Number one, I want to make it very clear that the Uhuru Sickle Cell Run will be an annual event. And this is the first edition of the event. And we look forward to receiving you again for the second edition next year. But to begin with, in Uganda, we are having about 17% prevalence of sickle cell. Unfortunately, in Lango sub-region, Leptong district, to be specific, is the one leading with about 23.8% prevalence. You realize that this is above, far much above, the national prevalence or the national rate. So the CAPSI felt important to contact some of us to at least have a role to play, in ensuring that we mobilize resources to fight, to reduce on this sickle cell. So this year, 2024, we're having a target of the procurement of 2 sickle cell machines. One will be in Lira Regional Referral Hospital, and one will be serving the people of Aleptong, specifically in Aleptong Health Center 4. So our appeal to the people of Uganda, our appeal to the people of Lango, our appeal to the corporate bodies and entities is that we should come together on the 5th and be part of this cause. We want to thank so much the security of Lango sub-region, specifically of Lira City, for at least taking keen interest in this run. But above all, we also want to thank those who have already bought in their kits, and they are now set and ready to participate. We want to thank our promoter, who did so well, most especially in social media spaces. And now we are proud to say the information has reached so many people. Thank you for the job well done. We still look forward working with you as close partner, as promoter, in ensuring that sickle cell is kicked out of Lango sub-region. We want to thank so much our partners, those that we contacted. You will see in our backdrop, we have so many, but we want to point out some few. Number one, we want to thank our chief runner, who was meant to come and flag off this event, the First Lady of the Republic of Uganda, and the Minister of Education and Sports, Mama Janet Kata Museveni, who indeed has already supported this noble cause with 10 million shillings. And we can't take that for granted, most especially for the people of Lango. This is a very good boost in attaining our target. We also want to thank so much Sir Gordon Wavamumunu, who is a proprietor of Spear Motors in Kampala. He has supported us with 15 million shillings. And indeed, he has already sent the money to the service provider. We also want to thank, in a special way, Stanbic Bank Uganda for a very generous contribution of 10 million shillings. With us, we have KCB Bank. I don't know whether I say KCB, the bank is already the B. But they have already contributed to the tune of 3 million shillings towards this cause. I mean 5 million shillings, not 3, 5 million shillings. Ladies and gentlemen, we have Sky Water. Will be helping a lot the provision of water to the runners. I hope even the members of the press will be part of this. Not only taking the news, but running while taking the news. Oyugi Frank, you are very good at dodging these things. So we have enough water from Sky. Water is an indigenous company in Kole, and they're doing a good job. We want to thank them. We also want to thank Pepsi. On that day, we will have them with the tents, with the sodas, and I am sure that we are going to enjoy the day. And many others. Uganda Christian Institute procured 10 vests for the staff. Keframa High School, Prime, Amazon, Vintage, Voice of Lango, Unity. But above all, we want to thank the two ministers who hail from this sub-region. The government chief whip today surprised the nation by procuring 30 vests, 30 kits for the people of Ajuri. The Ajurians. So if you are from Ajuri, count yourself already lucky. You have the vests. We also want to thank Dr. Jane Ruth Achenguchero, the Minister of Health, but the woman member of Parliament of Lira City, she has done so well. Number one, technical support, because as I talk now, on Friday evening we shall be receiving a big team from the Ministry of Health, including the commissioner.
Actually, commissioners.
The commissioners will be coming. So we want to thank her for all the support that she has rendered to this run 2024. We also want to thank so much, so much, some institutions in Lango sub-region, but also we want to appeal to radio stations who have not yet got their kits, to petrol stations, to business entities, companies that are meant to identify with us. We want to thank so much NTV for the support, NBS, UBC, you people, you have stood with us from day one, and we are sure even on the day of the run, you are part of us, and all the media houses. So with these very many words, I want to take this opportunity to unveil to you the official that we'll be using. I don't know whether I should stand or I should sit still. I sit. This is one of the kits that we'll be using, and it has the purpose, that is Uhuru Sickle Cell Run 2024, and we have the theme. Our theme for this run is breaking barriers, building hope for the sickle cell. So this is the official red vest that we will be using. And behind, we have some of the sponsors. I know you can have a look. But notably, we have DFCU there, we have KCB Bank, we have ABSA. Some of these organizations that are yet to disclose to us, that I mentioned before, like Stanbic Bank, like KCB Bank, like Wavamuno, like Firstly, we are. That is kit number one. Kit number two, because we have choices. There are some people who will say this red is UPC. You know, we have different political perspectives. We have also brought in orange. Somebody will ask why yellow is not there. You know, yellow is the mother of all these colors. Yellow is the mother of all these colors. These are children of this of yellow. The second color is orange, and we have the name of the run, that is Uhuru Run. Behind we have our theme. So any of these two, when you happen to get it in any stations, we shall announce to you where we can get this, please. But this we also have, can go hand in hand with the cap. This is the official cap of the run. You see it's beautiful, classy, and yeah. So most especially ladies, And the young people like Otwe who love beautiful things will always go for this. So this goes at 30,000 Uganda shillings. These two kits, the cap and the vest. Yes. This one alone is going at 20,000 shillings. So you can make a choice either to go for this or the other. With this many words, I want to thank you once again. But we want to give a clear message to the people of Lango. As a chairman and as a leader, we cannot expect support from external. The best we can do, the men and women you are seeing here are from here. They understand the problem of Lango, and it's upon us, Lango, to get the common solution to these problems. Sickle cell is real, and people are victims. We can't keep on lamenting with others. We must take up the responsibility. We must wake up from our comfort zone and take this initiative. This initiative is from our own, and we shall use all it takes to see that we support the most vulnerable. It takes about 100 million to 500 million for a bone marrow transplant. 100 to 500 million. How many of us, how many of our relatives can afford such a cost? But when we have a machine, we appeal to young people who are falling in for love. Before any sexual intercourse, please go to the facility, because Uhuru Sickle Cell Run 2024, in Jesus' name, we'll have opportunity to procure these two machines. We are having these machines. If you fall in love and you have an intercourse, please go and test. Because if your boyfriend or your girlfriend, if both of you have got this, then it's most likely that you will produce a child who is a sickler. But if one is a carrier and one is normal, there's a probability of you, not even a probability, possibility is there that you will produce a normal, a non-sickler what? Baby. So the idea of us looking at AIDS, hepatitis B, and not thinking of sickle cell, and yet is one of the biggest challenges economically. President Museveni every other day is talking. Some of us who are appointed, we are talking. We are saying, please, economic empowerment does not call for political parties, does not call for religion, does not call. You need to be empowered economically. If you're having a child who is a sickler in your home, one, you will be economically drained. Because every time you are at those steps of the hospital, every time. But also, two, you will not be actively participating economically, engaging your productive time, because you will be unattended. So prevention is better than cure. This is our attempt to ensure that we have these machines to save the people of Lango. We want you to put politics aside, religion aside, clan aside. I've been on radio station, I made it clear. There are three things that will never compromise your status. Number one, anger. When you are hungry, it will not challenge you whether you are DP, UPC, or NRM. The anger will demand that I need food. Number two, when you are sick, we shall not first verify whether it is an NRM nurse or an NRM doctor treating you, or a UPC nurse or doctor. You will be at the mercy of the doctors. Number three, when death calls, you know, it's not only one political party dying, one religion dying. Everybody is what? Dying. So we must be sober when we are taking the social community responsibilities like this. We must be sober, we must be independent, and we must act, and we should act now. I thank you so much.
Awareness and sensitization. And that also falls into one of our core niche as an organization, to raise more awareness and sensitization. There are still other challenges, but however, I would like to thank the Ministry of Health that the moment the newborn screening was introduced, this is helping a lot in early diagnosis and also management of sickle cell, given the fact that sickle cell is a chronic disease. That means that you will lose lots of money in trying to manage sickle cell. We currently have hydroxyurea, and hydroxyurea is more or less for managing certain pains, the episodes of infections, and so on and so forth. Bone marrow transplant, it is so expensive, like the chairman hinted on. Somebody deep down in Omoro, in Alolololo, might not be in position to afford this, to afford bone marrow transplant. 120 million to close to 500 million. So somebody deep down now in our villages there might not easily afford. And the best way to help us combat this is prevention. Before you get married, before you get sexually active, we advise that students or whosoever is intending to get married should not stay. Why the HB electrophoresis machine now? The HB electrophoresis machine will help Lira and Aleptong districts in doing confirmatory tests, because currently all the tests which are done from this region is sent to the Central Public Health Laboratory. And once it is sent, that means sometimes it takes some good numbers of weeks or months without the results coming back. But once this is available, that means once you have been tested on any other RDTs and you have proven to be having some traits, that means literally confirmatory there and then that referring you to Kampala. So the turnaround time will also, it is more or less like about 15 minutes. So that means that time will also be saved. You're getting your results in a timely manner. Our organization, we mainly deal with about 434 core areas. One of them is awareness and sensitization, patient care and management. We do talk to a number of caregivers, people who, like mothers and fathers of these warriors. We call them warriors because of the episodes of pain that they do go through. I'm sure Frank, right behind there, has ever tried tying his index finger with a rubber band. If you do it for so long, it will turn dark, right? With a lot of pain. It's just an iceberg, or just a very minute portion of the pain that these warriors do go through. Doing massive testing around institutions. We have met some stakeholders to try and let them know that, one, sickle cell is not a death sentence, and sickle cell is not caused through witchcraft. We have been to villages, a number of villages, where people are associating sickle cell to witchcraft. So we have been trying to demystify this myth in this region. And the fight against sickle cell does not, it has to begin with you, with I, so that we carry on these messages to the last person down there. If we only had the same approach that His Excellency, the President of Uganda, has been using to combat HIV/AIDS, that 95-95 casket of elimination of HIV, we would have been far by now in trying to combat sickle cell. We are very much appreciative of a number of partners and donors that have come up on board to support us. The President's office has been with us right from day one in trying to galvanize our efforts towards combating sickle cell disease across the country. NICOSAM has been there. Stanbic Bank, KCB, and all other partners, they have been there for us. And we are still hopeful that, one, more partners are coming up on board. And we are doing this for Lango. There was a request already in Gulu. There is another request in Fort Portal, in Tororo, that next year's run should be held in all those districts on the same day. Yet this is only the first time that we are organizing such a run. So that calls to you that we need a concerted efforts, or we need to augment our different efforts towards combating sickle cell. Come that day, on Saturday, the 5th of October, lots of, and this is also an opportunity for a number of our hospitality places around Lira to host them. We have quite a number of people who are coming from Kampala, and our very own Julius Achon is coming. For the first time, some of us, we have never seen him run around, but we'll be seeing him take on some kilometer, which Fred here will come and tell us is very much ready. Moses Kipsiro, we have never seen him run physically like this. He will be here present. So that is also an opportunity for people to come and, besides raising money for awareness, there will be lots of networking events. Different companies are coming to showcase what they have been doing. Different pharmaceutical companies are there coming to show you different products which they are currently.
Let me ask you before we shift. One might wonder challenges that you have, the burden that is beyond. How is the run going to address this?
Fine. One, I hinted about sickle cell. This region having the highest prevalence of sickle cell. Today we shall have lots of parents gone bone marrow transplant. They will be telling us their experience. We also have couples whom, after finding, like today, Wednesday, they have they had their introduction on Saturday. The moment they discovered that, one, they were all carriers, they had to sit down and agree on certain things. So we shall be having people there to talk to us, people who have undergone all these processes, the pain, the survival. Catherine Field is an indigenous organization. Catherine was a very nice lady who had the heart of community. Trophy, supporting children. Transplant. So name, no, it is our name here. In other words, in the local name, somebody would say, Catherine Kede Pilipo. That's it. So, apart from that, we shall be having, people should come as free of charge, totally free of charge. There will be counseling sessions on that day for people who want to test to know their sickle cell status.
How much is this machine?
Each machine is 15 million shillings.
And what is your target?
Our target is to at least even raise as much as get machines. Because once you set some target, you also need to project on, now like for example, our target, but we have been mentioning 2. But should we hit the target and surpass that, we have no option to have the 3rd machine up. And we shall work closely with the Ministry of Health to know where the machine. This machine has already been validated by the Ministry of Health. We are not just going to maybe procure it and say, Mahekuri Komu. No. We are in close collaboration with the Central Public Health Laboratory. And this machine is validated, the Gazelle HB electrophoresis, here, Uganda. So we are not doing anything behind the Ministry of Health.
Shouldn't we achieve
Shouldn't we achieve this? Very many people will continue going to marriages without knowing their sickle cell status. We shall have high number of sicklers around, and that means it will even cause poverty. Because one cell patient home, you can't save money. Almost every week you're running to the hospital. You can't afford to save any money.
afternoon, ladies and gentlemen. Queen again, coming in as the coordinator of Lira City Allies Club. About sickle cell, Lira City Allies Club has always organized sports, corporate games every first Sunday of the month, and we have used sports to create awareness about sickle cell disease. We are so glad that people have followed it up and they have come to know what sickle cell is in our community. I would like to thank the media houses, all categories, social media platforms. We have been using your platforms, your spaces to push the awareness of sickle cell, and most importantly, the Uhuru Sickle Cell Run. Way back from May, we have been pushing and promoting the run. We are not stopping here, we are still pushing. The run is on Saturday, 5th. So I call upon all of us, all the communities, to come on board and we participate in this cause. We have not left anyone behind, as the slogan says for Catherine Fields. We have gone to each and every personality. We have reached each and every personality to make sure that at least they come and participate in the run. I will not stop without thanking some of the people we approached, like the Pakistani community that has really been on board. It has secured 10 running kits. We have gracious group of companies that secured 30 running kits. We also have a Keshwara group of companies that secured 15 running kits, and other people. So I call upon everyone who has not yet come on board to really come on board and we make this day a successful one. Thank you so much.
From your experience organizing such sports events, what hopes do you give us that this will actually be achieved, even if we see as if it's a big thing?
Wow, this is a big thing indeed. And the fact that we are already here, that is one achievement. I am too optimistic that we are going to achieve this. Come Saturday and witness. Thank you.
Are we good to go? Good afternoon, ladies and gentlemen. My name is Kosi Eton. I am one of the directors of Lira Corporate Gala. As my colleague has mentioned, we are a team that works to promote games and sports in Lango sub-region. And we only don't stop at sports. We have actually been in partnership with a lot of organizations, including my immediate neighbor here, Stanbic Bank, and others. Now, what do we do at the gala? At the gala, we rally the community to come together. And when the community is now with us, that's now when we attack. How do we attack people? We have always been using games and sports in order to bring people together, and then we do the screening. The screening not only for sickle cell, but for other ailments as well. I have to let you guys know that we work closely with JCRC. They have been doing a lot of activity with us. Catherine Field did not just start this year. We were with them since last year, doing a lot in as far as sickle cell is concerned. And we have also been working closely with Lira Regional Referral Hospital. Now, I don't want to mention what has already been said, but my appeal to the community of Lango sub-region is, please, come in big numbers on Saturday so that we support our warriors. I know we still have a lot to do, but we shouldn't just stop here. Let us not look at this run as something that will only take place this year. We should always advocate to actually fight hard to make sure that we reduce on the number of sickle cell in Lango sub-region. Not only in Lango, even in Uganda. I am a testament to sickle cell. Personally, I've lost 2 nephews. One died last year in May, and one passed on this year in April, barely one year. So if you have not been affected by sickle cell, you will not know the pain that one goes through. And not only that, I have a niece who is actually in India right now. She went for bone marrow transplant in India. That is a daughter to our last born in the family. So I just call upon people, let us join hands and we see a way of supporting the warriors. Thank you so much.
How much has it costed you to take that side for the transplant?
It is expensive. We have so far spent about 200 million with support from other well-wishers. So it is really, really, really something so touching. I wouldn't want any other person to go through it.
Thank you. So can we...
Are we good? Yeah, ladies and gentlemen, once again, good afternoon. My name is Patrick Kibwata, like I said, from Stanbic Bank, here on behalf of the branch manager, Lira branch. As Stanbic Bank, we are very privileged to be part of this very noble cause. First of all, to extend appreciation to the organizers of this sickle cell run, Catherine Phil, the sponsors, and the partners. As Stanbic Bank, one of our mission is, or very key in our mission is that Uganda is our home. We drive her growth. And for us here, we say, Lango is our home, we drive her growth. How do we then drive the growth of Lango? We can only drive it through giving back to the community. As Stanbic Bank, we came out to support, and management found it deem it fit that we give up to 10 million shillings to support in procurement of the machine that is going to be stationed in either Lira Regional Referral Hospital or in a leptom. I would like to call upon all the other corporate institutions. There is still time. We have a lot of time. Please come in and support. A support to the community, to the country. I think that is it from Stanbic Bank. Thank you. All right.
Well, good afternoon, ladies and gentlemen. Like I mentioned earlier, my name is Daniel Ayena. I'm the branch manager of KCB Bank Uganda Limited, our Lira branch here. I'm here on behalf of our mother company, that is KCB Bank Uganda Limited. So as KCB, we are super excited to be doing this partnership with Catherine Phil to ensure that we organize a successful Uhuru sickle cell run so that our population are sensitized, and those who can get the testing, the medication, have access to these services. As KCB is not the first time we are doing such partnership. We've done this before with Lira Regional Referral Hospital about 2013, where we donated 2 incubators to take care of our newborn babies. So we are excited. Like I mentioned earlier, we've supported this run with a contribution of 5 million. And our hope is that this is not the last, okay? Because we know, like the ED mentioned earlier, it's going to be an annual event. And it's a call to all our other partners, the corporate bodies around, let's join hands. Because when you look at the costs that are involved for an individual to get treatment for sickle cell, it's really on the high side. But if we join hands together, it's beyond just business. It's about health. And you know, a healthy population is a productive one. So we need to come together and ensure that this run is a successful one. And this directly fits into our purpose as KCB, which is for people, for better. We cannot have a better population when they're not healthy. So in brief, that is it from KCB. Thank you very much.
Thank you, KCB.
Thank you once again. My name is Superintendent of Police, Patrick Jimmy Okema. As I said earlier, the Regional Public Relations Officer. Looking at the mandates of the Uganda Police Force, which is enshrined under Article 212 of the Constitution of this country, I feel I have the pleasure to join my colleagues to make a statement in line to the Uhuru Sickle Cell Run, which is scheduled for 5th of this month. We received a notification and request for security, as well as invitation to participate in this noble cause. Personally, I and my other colleagues, we have secured the kits for the run, and we are equally ready to participate on that day. We have developed an operational orders as well as a deployment plan to this effect. To support our planning, we need to come out with something of that nature. We did a route mapping together with the organizers and confirmed there's going to be a 4 kilometers walk, 10 kilometers run, and 18 kilometers run. For 4 kilometers run, the whole point or the starting point is Lira Town College Playground. It will move to Lira Chambers along Obote Avenue to Centenary Bank via Pacific Hotel to LPC, senior quarters, towards NRM offices. We go to Lira Hotel and back to the runabout and Obote Avenue, then to the playground where we began from. That is for 4 kilometers walk. Then 10 kilometers run, we'll start from Lira Town College to via Lira Chambers building to Obote Avenue to Uhuru Bar, Ireda Lumumba, Ireda Agali, towards the home of the Honorable Minister, Dr. Ruth Acheng Ochero, to junction of Adeko Kwok, then to Lango Cultural Center, Timber Yard, Corner Walk, Lira Main Runabout, and back to Obote Avenue, and finally to the starting point, that is Lira Town College. Then for the 18 kilometers run, which starts from Lira Town College, move via Lira Chambers offices, new building, to the runabout of Centenary Bank, to Total Runabout, up to corner Boroboro, then to Dr. Bote College, British Corner, Adeko Kwok, then to Lango Cultural Center, Timber Yard, Corner Works, to CPS Runabout or the main runabout, Obote Avenue, and finally back to Lira Town College. Basically, as security, we are prepared to secure the event. Deployment will be done early enough. Logistically, we are equally prepared. Ambulances have already been secured with medics attached to them. And so far, so good. We are so much committed and prepared to secure the Uhuru Sickle Cell Run. I urge members of the public to come in big numbers, first to socialize with friends, but above all to meet the objectives of the organizers towards this Uhuru Sickle Cell Run. Thank you for listening.
Thank you. Ladies and gentlemen, and members of the press, we are going to, I don't know, you advise whether we stand. We are having a solidarity of action where each member here will at least have a sickle cell running kit, a display of action in a photo.
Okay.
Is it okay? Yeah, we're good. All right. Thank you. Thank you. Thank you. Administrative announcement.